Okay, hi, I'm Kamaya. I'm going to do both of my skills in one video because they both correlate with one another.
Hi, I'm going to be your nurse today. I'm just going to take your blood pressure and also your pulse ox. Can you tell me your full name and your date of birth? Pickle Dingo Hopper, October 20th, 2020. Okay, thank you. Thank you so much. Okay, so I'm going to wash my hands off on the side, make sure my hands are clean. And I'm going to first take your arm, so I'm just going to lift your sleeve a little bit. And I'm going to take my blood pressure cuff. Well, first, make sure it's on. That is like a huge problem if this thing is not on. So, it's on. And then I'm going to take the blood pressure cuff. And on the side, it has an artery mark right there. I'm going to line it up with her artery. Another thing to note, you want to make sure you're in the close proximity range, so use your fingers and feel for that pulse point. Okay, so I'm putting the cuff around the patient, and then afterwards, I'm just going to start the inflation. Okay, there we go. So now the machine is going to start taking her blood pressure, and now we don't actually have it, but afterwards I'm going to take her pulse ox as well. You will just take their other hand, and you'll take their index finger, and you will just place. Is that comfortable? Yeah, you're good. You will place it on their finger and press the button and it will start to take their measurements. And now we wait for both of them to finish. Do you want to pause it for this part? No, I don't want to go. This is the exciting part. All right, and so now it is all done, and you can see her systolic pressure is 130, and her diastolic pressure is 99, so she is in a good range. And as far as the pulse ox, we have 98 beats per minute. And so I will just take off the equipment from her. Now, contrary to the chart, even though my blood pressure looks high, that's normal for me. So you also want to make sure that you are paying attention to what the normal is for your patient, because I have a tendency to be higher in my pulse rates and my blood pressure rates. All right, and now I'm gonna put all my equipment away. And do you have any further questions for me? No, ma'am. Okay, well, you have a good day. Awesome.
So, as previously seen, my blood pressure was 130/98. Now, while that does seem extremely high, as you heard Kamaya say, that is normal for me. My blood pressure is typically pretty up there. It's just how it's always been. I don't have anything wrong with my body. It is just how my body functions. But I do have a blood pressure diagram. And so with that, you will have hypotension, which is when your blood pressure is way too low for your body. So your systolic is going to be 90 and below, and your diastolic is going to be 60 and below. Now, you could have a normal systolic, but you could have a super low diastolic, and vice versa. And that goes for any of these. Low would be from 90s for your systolic, and then 70s for your diastolic. Your normal ranges should be between 100 to 120, and your diastolic should be roughly greater than 80. Pre-hypertensive would be 121 to 139 for your systolic, and then your diastolic is going to be 80 to 89. Your hypertension stage 1 is going to be 140 to 159, and then your diastolic is going to be 90 to 99. Your hypertensive 2, stage 2, is going to be anything greater than 160 and anything greater than 100. That's going to be your systolic, your diastolic. Your hypertensive crisis is going to be anything above 180 and anything above 110. Now, as you notice towards the end, I just started saying, for example, 180 and then 110. Now, the reason I do this is because when you are speaking in terms of blood pressure, your systolic is always going to come first. No matter what. When you're speaking, it's always going to be systolic, then your diastolic. Your systolic is also always going to be your top number. Your diastolic is also going to be the bottom number. So think of it like division. Systolic over diastolic. Systolic over diastolic. Sometimes you'll have the number written to where there's a slash in between. That first one is your systolic. Second one is your diastolic. So